Hey there girly, it's Coach Kristen here, and today we are going to be doing infection control in depth, okay? So this module is super important because this is going to be covering questions that can be on your state board exam, okay? So make sure that you go over this module in depth and that you watch this as many times as you need to, especially when it comes to helping you study for your exam, okay? So a lot of these words should sound familiar since we have already learned a lot of this vocabulary, okay? But like I said, please just make sure to go over this again and again and again. Some of this stuff I may sound like a broken record because I'm just repeating myself. However, like I said, it's just really important to understand and to know, okay? So let's go ahead and dive in. As always, if you have any questions or you need help, just make sure to send me an email or hop on our Wednesday coaching call. Okay, so state boards and other regulatory agencies require that infection control measures and safe work practices be applied while serving the public. So infection control refers to the methods used to eliminate or reduce transmissions of infectious organisms from one individual to another. State boards and other regulatory agencies, since transmission can also occur when using contaminated instruments, tools, or equipment, the performance of effective infection control procedures must be top priority in your business. Safe work practices require that implements, tools, and equipment be used safely and that you should be aware of situations that can cause accidents. So in this module, we're going to cover what can we sanitize and disinfect? What can we not sanitize and disinfect? How do we clean? How do we handle accidents if we have accidents in the workplace, okay? So it is your responsibility as a licensed lash artist to use proper and effective infection control practices to help prevent accidents and injuries from occurring in the workplace. Okay, beauty professionals should study and have thorough understanding of infection control, which is what we're doing right now. So, we have your license, you're going to get your lash license. You want to make sure that you protect your license, that you do everything right by it. So that's why we are covering everything today, so that way you know what could happen in the case of infection control or something happening that you come in contact with a client. And we just want to make sure that you keep your license safe and good standing, okay? So it's important to know about pathogens, professionalism, and their clients that may be exposed to their modes of transmission, okay? So understanding and practicing proper infection control within the laws and the rules will safeguard professionals' health, the health of others, and your business. Okay, so infection control on the home front. Practicing safety precautions on a daily basis protects you, your clients, and your license. So consider some of these things. How often do you sweep the floors of your home? How often do you mop the floors of your home? Continuing on in infection and control on the home front, practicing safety precautions, like I said, on a daily basis protects you, your clients, and your license. So how often do you clean and disinfect the bathroom? How often do you clean and disinfect the bathroom doorknob? Okay, so if you are working from home, or you're choosing, maybe you have a she shed, or you have a private office, but you're choosing to work from home, please make sure that you are cleaning your house every single day, cleaning your space every single day, the same way you would your office or your lash space that's away from your home is the same way you would treat the one in your home as well too, okay? So if you are working from home, please make sure that you are cleansing your space and cleansing your area and cleansing your house as well too, okay? OSHA and EPA. So we've talked about what OSHA and EPA is. OSHA is a state regulatory agency that exists to protect beauty professionals and their customers' health and safety during services. State regulation agencies include licensing agencies, state boards, commissions, and health departments. Okay, so make sure that you can recognize the principles of infection. One careless action could cause injury or spread of disease, which is any abnormal condition of all or part of the body and its system, or its organs that make the body incapable of carrying on normal functions. If your actions hurt a client or make them ill, you could lose your license or ruin your space reputation. Fortunately, preventing the spread of infection, the invasion of body tissue by disease-causing pathogens is possible when you know proper procedures and follow them at all times. Okay, so let's talk about some different modes of transmission, which is there's direct and there's indirect transmission. So the pathogen, as we can see right here to the left, we have bacteria, we have viruses, we have bloodborne pathogens, TB, tuberculosis, and fungi. Okay, so if you were to come in with a contact with bacteria, contact time is 30 seconds. Viruses, contact time is a minute. Bloodborne pathogens, contact time is a minute. TB and fungi is 3 minutes, okay? So just know a couple of contact times are different depending on what pathogen you are coming across, okay? So that means these pathogens can live on the surface for up to this amount of time. Okay, be sure to mix and use these disinfectants according to the instructions on the label so they are safe and effective. So this isn't just our barbicide mix, this is also if you're mixing bleach or if you are mixing any other chemicals, you want to make sure, like I said, to mix these disinfectants according to the instructions and the manufacturer on the labels, like so they are safe and effective. If you don't follow the mixing rules, then it probably isn't a good disinfectant, okay? So if you have not learned how to mix our barbicide, here is a demonstration of how to mix your barbicide, okay? So, or if you want to make a spray, so if you are putting this in a container for your lash tweezers, then obviously you're going to just place you're going to fill up 2 ounces of barbicide and then fill the rest up with water. If you're using something to clean your tweezers, but if you were using a sprayer bottle, this is showing you how to fill in with your barbicide, okay? So you're going to add 2 ounces of barbicide, and then you're going to fill the rest up with water, okay? And then that's it. Always make sure to add your chemicals first, then your water. Never water and then your chemicals, okay? Always chemicals and then your water. Alright, so super simple. It's really easy to mix barbicide. All you have to do is put in your acquired amount, depending on, like I said, whether you're making a spray bottle or whether you're using this for your tweezers. But just make sure and fill up your barbicide by the measurements, and then you will fill in the rest with water. And that's all. Mixing barbicide is really easy, okay? Alrighty, Prevention 101. So, a couple of ways we can eliminate transmissions and diseases or pathogens or anything like this, okay, is by all of this prevention, okay? So eliminate pathogens through proper hand washing. Washing your hands is super important. You also need to make sure to clean and disinfect your tools and equipment after each service, okay? After every single client. Clean and disinfect your tools, your lash bed, your door, so I say this way I have to clean in between every single client. And then you also need to keep your skin intact to reduce portals of entry from bacteria, so wear gloves and working with chemicals. Making sure there's no broken skin, no rashes or wounds or anything like that while you're working on your client, okay? And be prepared to turn away clients who show signs of illness. So even rashes, broken skin, open wounds, coughing, fever. Remember, you are not licensed to diagnose and treat and treat any client if they have any of these things, but you do need to be prepared to turn away a client who shows any signs of illness. So even if you're seeing rashes on the skin, open wounds, anything like that, you will need to turn away your client, because then that can, cause transmission in your space, and then someone else can get that or you can get that, and we want to prevent all of this, okay? So how can we prevent? Through proper hand washing, through cleaning and disinfecting your tools and equipment, through avoiding skin contact, reduce portals for entry of bacteria, and also being prepared to turn away clients who do show signs of any illnesses, okay? Personal habits. It's important to think about your personal habits in terms of how they might increase or decrease the risk of transmitting an illness. So, for example, if you see 50 clients a week and you shake hands with each of them, you are exposing yourself to everything on the hands of those 50 people. So, every week it's only a matter of time before you will get sick. So, however, making a habit of following proper aftercare and cleaning can prevent all of this. So, even if you have a busy week, you should make sure that you do all of your cleaning, wash your hands in between, take care of everything, and you will not get sick. And this really is true. Just this past Thanksgiving, it was everyone was starting to get sick, and I had quite a few clients, maybe like 10 or so clients come in, and they all had the sniffles and everything. But because I washed my hands, I wore my face mask, I did everything right on my end, and I cleaned up everything, no one got sick, I didn't get sick, none of my other clients came in and got sick after that, okay? However, if all those clients came in and then I didn't wash my hands and I didn't wear a face mask and I didn't clean up, I probably would have got sick and someone else would have got sick as well, okay? So just make sure, like I said, you're following proper aftercare and cleaning to prevent all of this. All of this can really be prevented by simply washing your hands, cleaning up, and not letting any of what our clients bringing in or what we're bringing in linger around for the next client, okay? Alrighty, so let's identify some different type of pathogens. So there is contamination, which is the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item surface or visible debris or residues such as dust, hair, and skin. Then we have decontamination, which is the removal of blood or other potentially infectious material on an item surface and the removal of visible debris or residue such as dust, hair, and skin. So make sure you know the difference between contamination and decontamination. The most frequently encountered fungal infections resulting from hair surfaces is Tinea barbae, also known as barber's itch. A person with Tinea barbae may have deep inflamed or non-inflamed patches of the skin on the face or on the nape of the neck. Tinea barbae is also similar to Tinea capitis. So this right here, seeing patches on the skin, on the neck, more towards the hairline is Tinea capitis, okay? But Tinea barbae is these, like I said, deep inflamed patches of skin on the face or around the neck. Right here, as you can see. And so basically this is showing you a regular hair follicle and then an inflamed hair follicle. So this is what's happening when our clients are experiencing any sort of fungal infection. This is from hair service, okay? So we won't have to worry about this with lash extensions. However, if your client comes in with any of these rashes around her neck, face, or anything like that, then you will need to cancel the service and have her reschedule for another time, okay? Ringworm. So ringworm is a fungal infection of the skin that appears in circular lesions and is another fungus that may contradict a beauty service, okay? Contraindicate a beauty service, meaning we can't service our client if she comes in. So yeah, girl, I mean, this isn't just like lashes or if you see anything around the eyes. Also, we have to do like a full analysis. If you see anything on our client's skin, on her neck, on her hands, on her arms, chest area, anything like that, you're seeing any type of skin lesion, skin condition, rash, broken skin, anything that can affect you and your service and your other clients, then you will need to turn your client away if they're having any of these, okay? So we will be covering a lot of contraindications, meaning if clients are showing certain symptoms or certain signs of any kind of infection or something that is contagious, like a ringworm, that is called a contraindication, meaning you will not be able to service them and you will be saying no to servicing that client, okay? Sterilization. So sterilization is the process that destroys all microbial life, including spores, and can be incorporated but is rarely mandated. So effective sterilization typically requires the use of an autoclave, which is a piece of equipment that incorporates heat and pressure. For sterilization to be effective, items must have been cleaned prior to using an autoclave. So remember, you always have to wash your tools, anything that you're putting in your autoclave, wash your tools with warm water and liquid soap. antibacterial liquid soap, and then you will place them in your autoclave. Okay, so I have showed you guys this autoclave down here. This is one that I actually use for my tweezers. You can order these on Amazon. They run anywhere from 10 to 20 bucks. There also is some, like this one kind of looks like a little washing machine. I don't know why when I see these little washing machine ones, I think of like I think of the little washers that you use to wash your strip lashes. I don't know why, but these are what the autoclaves look like. Okay, so these are a piece of equipment that incorporates heat and pressure. So this is sterilization, which destroys all microbial life, including spores. So remember, there's a difference between cleaning, sterilizing, disinfecting. Make sure that you are, like I said, some of these keywords that we are going over, make sure and write them down, put them on flashcards. That way you know the difference between the words, because you are going to be tested over these. Okay, step 1, cleaning. So the first step of infection control is cleaning. Remember that when you clean, you must remove all visible and surface dirt and debris from your tools, implements, and equipment by washing them with liquid soap. So make sure to always wash your tools and remove, like I said, clean your surfaces and remove all visible and surface dirt and debris from the tools, implements, and equipment by washing them with liquid soap and warm water. Okay, so how should we clean our tools and also keep ourselves safe? So step 1, we're going to wash our hands, okay, with water and soap. Then we're going to place our tools in the soapy water, okay, gently scrub. Make sure and rinse under the water, let them air dry, or you can use a paper towel, clean paper towel to clean the tweezers, okay? Then sterilize the tweezer, make sure and clean anything that could be lingering off, and then store in a clean place, and then you are good to go, okay? So if you're confused on how to clean, this is a step-by-step on how you should clean not only your hands, but your tweezers, and then get set up for your next service, okay? So, before you think of disinfecting anything, even if you're going to put it inside an autoclave, you have to always clean the implement first. Okay, so you can't just put your tweezers from your service straight to your autoclave and be like, oh, they're clean, it's disinfected, now there's no germs on them. No, that's not how it works, okay? You have to wash everything off first, clean everything, and then you can put it inside the autoclave, okay? But again, all this information should be embedded in you, and you should practice great cleaning habits daily in your beauty business, okay? So none of this stuff should be new to you. This has been stuff from day one we've been talking about on how to clean, on how to make sure that everything is good to go for your services, for yourself, and for your clients, okay? So knowing the difference between an item you can and cannot disinfect, let's talk about things that we are actually able to disinfect properly. So meaning something that contains spores, something that does not have openings, so you cannot properly disinfect a sponge, right? Okay, using a sponge as an example, right? Because you cannot properly disinfect the sponge. Something like a sponge has pores and it absorbs, so once you're done with the sponges, you have to just discard them and throw them away, okay? But you do have to know the difference between an item that you can and that you cannot disinfect. So now something you can disinfect properly would be something like a nipper or your tweezers, or you can disinfect a table or your lash bed by spraying it. You leave your solution on there for 10 minutes and then wipe it down. But first you would get a towel or a paper towel. You would remove all visible debris and dirt off your table first, and then you would actually go in and use an EPA disinfectant, okay, or something like barbicide, for example, okay? So, wash your hands, okay? Washing your hands is so important. Washing your hands properly is one of the most important actions, and this prevents the spreading of germs from one person to another. Proper hand washing removes germs from the folds and grooves of the skin and from under the free edge of the nail plate by lifting and rinsing germs and contaminants from the surface of the skin. So you should wash your hands thoroughly before and after working with each client, and make sure to follow your hand washing procedures, okay? So how to wash your hands. Clean your hands with water and apply sanitizer. Rub your hands together. Rub the back of your hands clean between your fingers. Rub the back of your fingers against your palms. Rub your thumb with the other hand, okay? Rub the tips of your fingers of the palm. Rub all over your hands and your wrist area, okay? And then rinse your hands with clean water. Remember, you should be singing the birthday song every single time you're washing your hands. If it doesn't take you 30 plus seconds to wash your hands, you are not washing your hands correctly. So please make sure to go and wash your hands, okay? If you would really like to as well, you can also tell each of your clients to wash their hands before they come into the service area as well. Okay, but here is a guide on how to wash your hands. If you don't know how to wash your hands, make sure you understand how to wash and thoroughly clean your hands. Okay, there's also 3 ways to clean your tools and implements. So you can wash with soap and water and scrub them with a clean and properly disinfected nail brush, okay? Or you can use an ultrasonic cleaner, or you can use a chemical cleaner, okay? There's also waterless hand sanitizers like antiseptic germicides formulated to use on the skin and are registered and regulated by the FDA. So antiseptics generally contain a high volume alcohol and are intended to reduce the number and slow the growth of microbes on the skin, okay? So these are just some of the cleaners that you can use. Like I said, ultrasonic unit, so that means our autoclaves, okay? We have chemical cleaners, which is, Lysol, sprays, bleach, okay? Barbicide, hand sanitizers. We have hand sanitizers, wipes, okay? Lysol wipes, Cavi wipes, all of these are all of our tools that we are going to use to clean our tools, to clean our bed, to clean our supplies. So make sure that you really do understand all of our cleaning supplies, how they work, and what's the difference. Like I said, the difference between cleaning, sanitizing, disinfecting. What are each of these things doing, okay? But again, you have to also wash your hands. So don't just think, oh, I'm sanitizing my hands, that's all I need. No, you also have to wash your hands, okay? So don't ever just get hand sanitizer in between and think, that's it, I'm good to go. Nope, wash your hands and then you can apply hand sanitizer. Then you're really good to go, okay? Products and equipment that do not have the word disinfectant on the label are merely cleaners and they do not disinfect. Okay, so if you have bottles with cleansers and stuff that aren't labeled or don't have any labels on them, like I said, they're just cleaners. They're not disinfecting, okay? So isopropyl alcohol is effective in cleaning the skin. However, it can be very drying and cause irritation. Alcohol is not a disinfectant and should be used only as a cleaner or an antiseptic, okay? So step 2, we have disinfecting. Infection control and disinfection. Remember, disinfection is the process that eliminates most, but not necessarily all, microorganisms on a non-porous surface. This process, however, is not effective against bacterial spores. So like I said, remember, only sterilization is against bacterial spores, but disinfecting is not effective against bacterial spores, okay? Disinfection is extremely effective in controlling microorganisms on surfaces such as your tweezers, shears, scissors, and multi-use tools. The disinfectant in your shop must be EPA registered. Multi-use items should be cleaned and disinfected and used on more than one person, okay? So whenever we are working throughout the day, you are disinfecting your lash tools, but it also is really important that you sterilize as well, because that kills all bacterial spores and microorganisms, okay, with sanitizing, whereas disinfecting is not effective against bacterial spores and doesn't kill all microbial life, okay? Choosing a disinfectant. You must read and follow the manufacturer's instructions whenever you're using a disinfectant. Mixing ratios or dilution and contact time. The time is listed on the product label, required for the disinfectant to be visibly moist to be effective against a pathogen. Example, most concentrates have a 10-minute contact time, whereas most wipes have a 2-minute contact time, okay? So the difference between some sprays or like wipes is how long they have to stay on the surface in order to eliminate those eliminate and disinfect any pathogens. Okay, if the label does not have the word concentrate on it, the product is already mixed and must be used directly from the original container and must not be diluted. All EPA registered disinfectants, even those sprayed on large surfaces, will specify a contact time in their direction for use. Disinfectants must have efficacy claims on the label. Efficacy is the ability to produce the intended effect. Proper use of disinfectants. Implements must be thoroughly cleaned of all visible matter or residue before being placed in disinfectant solution. This is because residue will interfere with the disinfectant and prevent proper disinfection. So complete immersion means that there is enough liquid in the container to cover all surfaces on the item being disinfected, including handles, for 10 minutes or for the time recommended by the manufacturer. Okay, so make sure that you are, like I said, leaving your tools in your disinfectant, and then also wiping down and cleansing everything and leaving all of that product on for as long as it needs to in order for it to properly disinfect, sanitize, kill those pathogens and germs. Okay, so let's talk about the types of disinfectants. As a beauty professional, you will primarily be using disinfectants that are effective for cleaning blood and body fluids from non-porous surfaces. Quaternary ammonium compounds, also known as quats, are disinfectants that are very effective when used properly on non-porous surfaces. Then you have tuberculosis. So really quats, those are really all of our disinfectants, like Lysol wipes, Lysol sprays, things like that, Okay, so if you're confused on what Quats is, just type in Quats on Google, and then you'll see that that's what it just means. All these cleansers, disinfectants, sterilizers that we are using. Okay, then we have tuberculocidal disinfectants, which are proven to kill the bacterium that cause tuberculosis, in addition to other pathogens destroyed through the use of hospital disinfectant. So make sure you know what a tuberculocidal disinfectant is. Then we also have bleach. Okay, so far we have bleach, tuberculocidal disinfectants, and quats. Okay, bleach, household bleach, which is 5.25% sodium hypochlorite, is an effective disinfectant and has been used extensively in salons. Bleach used in a salon or spa must be EPA registered as a disinfectant. It is wise to always look for disinfection instructions on the label to ensure that the bleach you use is actually disinfecting. However, bleach is corrosive and can damage metals and plastics, as well as cause skin irritation and eye damage. To mix a bleach solution, always follow the manufacturer's directions. Store the bleach solution away from heat and light. A fresh bleach solution should be mixed every 24 hours or when the solution has been contaminated. This is a state board exam question. They will ask, how often should you mix a fresh bleach solution? And it should be mixed every 24 hours, every day, okay? Every single, a new mix should be mixed every day, okay? After mixing the bleach solution, date the container to ensure that the solution is not saved from one day to the next, but rather disposed of daily like other disinfectants. Same thing with your barbicide. Your barbicide has to be changed out every single day, okay? So make sure and know they are going to ask how often should your fresh bleach solution be replaced, and how often should your barbicide for your tweezers or tools be replaced. This is every 24 hours, which is every day, okay? Remember, bleach can be irritating to the lungs, so be careful about inhaling the fumes. Alrighty, disinfectant tips and safety tips as well. Always keep SDS, which is safety data sheets, on hand, so you can print one of these safety data sheets, and then you can mark on there when the barbicide was changed, what time it was changed at. That way every single day you know it's changed, it's good to go, okay? And then you could keep this safety data sheet inside the area, like wherever you put your barbicide at. That way after you replace your fresh barbicide, you can write on the safety data sheet, I changed it today, January 16th at 12:01 p.m. okay? Wear gloves. You can also wear gloves while you're doing not only your application but also while cleaning as well, okay, for disinfecting. Avoid skin and eye contact. Obviously we don't want to get none of these ingredients on our skin, on our clothes, and our face and our eyes, okay? Follow the manufacturer's instructions, so make sure and read the bottle, just like how you would, you're going to cook a pack of spaghetti, you would, look at the back of the box, see how many ounces of tomato sauce, see how it works, so same thing with cleaning, okay? Follow the manufacturer's instructions, okay? I had to learn a lot about cleaning because, like, I cleaned up like as I was young, but I didn't really know like how to clean. And then whenever it came to being like in a cosmetologist and learning like all the different like disinfectants and solutions and how what's properly cleaning and what isn't properly cleaning, it actually is really cool to know the difference between, because I just thought cleaning was cleaning, and it actually is not like that. There's different types of cleaning, so like I said, sterilization, disinfection, everything. So like really pay attention to all of these tips, okay? Keep an item submerged in the disinfectant for 10 minutes unless the product label specifies different. So with your tweezers, remember after you finish up your service, you're going to go wash your tweezers with warm water and soap, and then you're going to drop them in your barbicide, let them sit for 10 minutes, make sure they're completely soaked in the barbicide, and then after that you will remove them you will remove them from the barbicide, wash them again with warm water and soap, and then you're good to go, okay? But immerse the entire implement in disinfectant if the product label calls for complete immersion, which means, like I said, the whole item is covered, is submerged in the disinfectant. To disinfect large surfaces such as countertops or your lash bed, carefully apply the disinfectant spray and allow it to remain moist for 10 minutes unless the regulations say differently, okay? Alrighty, there's our disinfectant tips and safety. Never let Quats, phenol, bleach, or any other disinfectant come in contact with your skin. Like I said, it's gonna burn, it's gonna irritate, okay? So immediately wash your skin should you come in contact with any of these items. Wash the skin with liquid soap and warm water, okay? Disinfecting containers. In the past, jars or containers used to disinfect implements were often incorrectly called wet sanitizers. So these are not sanitizers. I know you've probably even seen this on my barbicide container that I have. I've showed you how to make barbicide, how to make sure and clean it, and all of that good stuff. However, these are not wet sanitizers, okay? Sanitizers do kill all of microbial life and kill all spores. These are wet disinfectants, okay? So these are disinfectant containers, and they contain disinfectant for disinfecting purposes, not for cleaning, okay? So the container you choose must be large enough to contain all items to be disinfected and covered, but not airtight. So remember to clean the container every day. Again, this is a state board exam question. How often should you clean your container? How often should you replace your barbicide? Every 24 hours, which is every day, okay? And do wear gloves whenever you do this, okay? So these are our disinfecting containers. The container you choose must be large enough to contain all the items to be disinfected and covered, but not airtight. So remember to clean the container every day. Like I said, this is a state board exam question, so that's why I'm showing it to you twice, and to wear gloves when you do, okay? So this is our barbicide container. You can get these at your local TDLR shops. I literally forgot. Okay, Armstrong McCall. If you can't get into Armstrong yet, you should be able to, because you have your student permit and you can use that number to go into these stores. But if you're not, for whatever reason, or you can't find a store near you, then you can always order these online on Amazon, okay? Or Google, whatever you decide to choose from, okay? Cleaning and disinfecting. So cleaning and disinfecting non-porous reusable items, the state rules require that all multi-use tools and implements be cleaned and disinfected before each and every service. So like I said, after you finish up your service, take those tweezers, go wash them with warm water and with our liquid soap, and then you're going to go and place them in your barbicide, let them disinfect for 10 minutes, and then you'll go back, wash them again, and then you're good to go for your next service, okay? Clean towels and linen. So if you're using clean towels and linen, bed sheets, blankets, anything like that, they should be cleaned and used for each client. So clean towels, linens, blankets should be laundered according to the directions on the item's label, okay? And if you are using blankets or anything like that for your lash service, please make sure to take those blankets home and clean them. They need to be cleaned every single day for each of your clients, okay? And make sure to follow standard precautions to protect yourself and your clients. Standard precautions are guidelines published by the CDC that require the employer and employee to assume that any human blood and body fluids are potentially infectious. So remember, asymptomatic is meaning that they show no symptoms or signs of infection. Make sure to go over that word, all of these words, anything that's underlined, these main words, like I said, just make sure and study and really understand. OSHA and the CDC have set safety standards and precautions that protect employees in situations where they could be exposed to bloodborne pathogens. Precautions including proper hand washing, wearing of gloves, and proper handling and disposing of sharp instruments and any other items that may have been contaminated by blood or other body fluid. So these questions, there's going to be 3 questions about OSHA on your state board exam, about OSHA, about EPA. So please make sure to go over all of this. Like I said, that way you do know, you're going to be prepared when you see this on your written exam, okay? So we are going to cover an exposure incident, and then we're also going to talk about how you would perform an exposure incident should this happen to you in your business. But we're also going to cover the steps that you would take in an exposure incident, because you are going to be tested over this whenever it comes to your your practical test with your eyelash extensions. This will be the last part of the practical with your eyelash extensions when you have to go in person, okay? So an exposure incident is contact with blood or broken skin, body fluid, or other potentially infectious materials. However, sometimes accidents happen while a service is actually being performed. This can happen. So an exposure incident, please highlight that it is contact with non-intact broken skin, so an exposure incident means that you are dealing with someone who is bleeding, or you've cut them, or there's body fluid coming out. So okay, make sure to understand that blood or body fluid or other potentially infectious materials that is in result of performance of a worker's duty should the client suffer a cut or an abrasion that bleeds during the service. Please follow the steps outlined for the client's safety as well as for your own. So as a beauty professional, you are likely to work with an array of sharp implements and tools, and cutting yourself or a client is a very real possibility. It does happen. If you do suffer a cut or blood is present, you must follow the steps for an exposure incident. Okay, so we're going to go over these steps. Again, you're going to want to make sure that you really understand these steps as well, because you are going to be tested over this. They are going to ask you to do a blood exposure incident at the very last portion of your practical exam, okay? So remember, this is over a mannequin. This is not a real person, so don't freak out, okay? So just make sure and follow these steps and pay attention, okay? So let's go over handling an exposure incident with your client step by step. So step 1, you're going to stop the service immediately. So whatever you're doing, just go ahead and stop the service immediately. Okay. Step 2, you're going to put on gloves if you are not already wearing gloves for the procedure. Okay, so if you're already wearing gloves for your lash extension procedure, that's okay. But if you weren't, go ahead and put on gloves. That's the second step. Okay. Step 3, we're going to face your client, calmly apologize for the incident. So let's just say you drop your isolation tweezers and you nip her top of her brow. Okay. Tell your client, oh my gosh, I'm so sorry, girl. My apologies. My apologies, okay? Most of the time your client will be like, it's okay. Calmly, don't freak out. Just say, oh my gosh, I'm sorry. My apologies, girl. Please give me a minute to clean up that way we can get back to our service, okay? So face your client, calmly apologize for the incident. If appropriate, assist your client. Step 4, if appropriate, assist your client to the sink. Wash the injured area with soap and rinse under running water, okay? Step 5, pat the injured area dry using a new clean paper towel. Okay, once you've washed off, cleaned it off, make sure to pat the injured area dry using a clean paper towel. Okay, step 6, offer your client an antiseptic and an adhesive bandage. So offer her something to clean up the cut with, and then also offer her something, a band-aid, a wrap, anything to put on top, okay? And then step 7, we're going to discard all single-use contaminated objects, such as wipes, cotton balls, anything that we used, okay, in a plastic bag, and then place in a trash bag. Then we're going to dispose our sharp disposables in a sharps box, okay? So dispose of our double bagged items and sharps container as required by the state or local law, okay? In general, all these items except your sharps may go into the regular trash. So if you have your sharp tweezers that you're using, you're going to put those into a sharps box and make sure and put them away. We're not going to throw them in the trash just yet, okay? But all of our other products are our gloves, anything we use to clean up our client, any of the leftover wrappings from anything we use to clean up our client, make sure to throw them away, okay? So step 8, make sure to remove all implements from your workstation and then clean and disinfect the workstation as well, okay? So after all this happens and you clean up your client, then you're going to make sure to clean up your workstation, clean and disinfect your workstation surfaces, okay? Then step 9, we're going to discard of our gloves, thoroughly wash our hands with warm running water and liquid soap, rinse and dry hands with a clean fabric or a disposable towel, and then put on fresh gloves, okay, to continue on with our service. Okay, then we're going to properly not continue on with our service. I'm sorry, we're putting on gloves, that way we can properly clean and disinfect our implements next. Okay, so we're going to discard of our gloves to thoroughly wash our hands with everything that we touched on our client. Then we're going to rinse our hands dry, put on some fresh gloves, and then we're going to properly clean and disinfect our implements, which is step 10. Okay, after we do that, then we're going to discard of those gloves, thoroughly wash our hands again with warm running water, liquid soap, rinse and dry our hands with the clean fabric or disposed towel, and then now we can return to our service, okay? Step 12, recommend that the client sees a physician if any signs of redness, swelling, pain, or irritation develop from whatever just happened with our client. Ask if our client would like to continue with the service and return to where you left off if they are willing. So like I said, most of the time your client will say, it's okay, let's clean it up, do what we have to do, and then just move on, okay? If your client is upset and she doesn't wish to continue, then, then you won't continue the service. But most of the time your clients are going to say, it's okay, girl, thanks for cleaning me up, getting everything taken care of. Let's go ahead and return with the service, okay? So if you are working on a client, if you continue to work on a client and they refuse a Band-Aid or a bandage for their cut, make sure that you put on gloves before finishing the service, okay? And these are our steps. So you will be performing a blood exposure incident service for your state board exam practical on a mannequin. Like I said, this won't be a real person, so no need to freak out, okay? All right? And the steps are very simple. Like I said, again, when you start, put your gloves on. You're going to grab some gauze, okay? You're going to apply pressure to the cut. We're pretending, okay, right now, but we're going by the steps, okay? So you will clean the cut with a little antiseptic wipe, then you will apply a Band-Aid over it, okay? All of the items that you use in the wrapping paper, everything will go into a Ziploc bag and then into a biohazard bag, okay? And the bag will be labeled biohazard. Again, this is for whenever you go to take your state board exam practical, okay? And then you will put that into another Ziploc. So 2 bags, but everything will go into those bags, okay? And then into a larger trash bag. And these are pretty much, like I said, this is all of the steps in a nutshell of what you will be doing for this part of your practical exam. And again, this is the blood exposure incident, so just go over your steps, that way you really understand, but super easy, okay? Stop the service, put on gloves, make sure and put some pressure on the cut, tell your client you're sorry after you clean her up, assist your client, clean her up, clean the area, make sure everything's good, give her some antiseptic, put a bandage on, then you're going to cover your steps, so you're going to throw away everything, make sure everything's good and sanitized, okay? Remove all the implements, clean your work surface, throw everything away, then make sure and clean your hands, clean your tools, again clean your hands, and then get back to the service, okay? So like I said, just make sure and go over everything, make flashcards on this module, on the information, and keywords in this module, okay? So here again are some keywords to make sure and go over: acquired immune deficiency syndrome, antiseptic, asymptomatic, bacteria, bacterial spores, bactericidal. We went over all of these words in our earlier vocabulary module with our infection control, but please make sure to go over these words again. Like I said, make flashcards, make sure you understand all these words, because there's potential for these words to pop up on your written exam, okay? So just make sure to study everything. And thanks for staying in tune for this whole module. I know this stuff isn't really fun. We're ready to do our lashes and get our clients in and do everything like that, but we have to make sure that we understand everything about cleaning and staying in tune with everything to make sure that we are good to go for our services and continuing on as a licensed lash artist. So all of knowing all this stuff, knowing everything will help you keep your license, make sure that you understand everything, and make you a really, really good lash artist, okay? So study, 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 study. If you have any questions, let me know. Hop on the Wednesday coaching call. Let's talk about it, and we will get you prepared for your state board exams, okay? Awesome. That's all I have for you today, girly. I will see you on the next module.